Hi everyone, my name is Joshua Meyer and I'm the Cancer Philosopher, and today we'll be talking about a few examples of how cancer was observed in history and how these observations of cancer led to its interpretation, a greater definition of cancer, and then later in the future to a better understanding of it and perhaps even some medications. So the first thing to consider was if cancer was described so long ago, was it really the same cancer that existed today? So first of all, we have to consider whether or not we have proof of cancer in earlier times. Just by reading about people's writings, does that really mean that they had the same cancer as us? Does that really mean that their cancer was proven? Did they really have cancer? That's a question that we have to consider. But interestingly, as is described in the book, in The Emperor of All Maladies, cancer has actually, in a way, been proven. Scientists have done studies, and they found 1,000-year-old grave sites. For example, they bring up an example of a remote sand-swept plain in the southern tip of Peru where cancer was actually met face-to-face. A corpse was found, and real cancer was found there. So not only do you see it on the morphological level, but you can see bulges basically within the person's body, but then you can sort of excise that and you can test that and see that it was indeed cancer. But the next thing to consider is whether cancer might have evolved. What's possible is, has cancer changed? Maybe they had a different type of cancer than we have now. Of course, cancer has become more prevalent as the world has progressed. Although, as the book discusses, it's possible that it's not that this was a different cancer, but rather society has changed. So it's not the cancer that has changed, but rather the surroundings of cancer that has changed. So, for instance, in the modern world, we live so much longer than people did back then. Cancer is, of course, correlated with longevity. And as we continue to age and our population becomes increasingly older, cancer just becomes something that has a higher probability of being gotten. So it's not that people didn't have cancer back then, it's just that there were other things that were killing them first. Another interesting thing to consider, I'll show some images of this in a moment, but there's a really nice quote that I like from the book, and I'll just say it just because it's just so beautiful. Mukherjee writes, "In some ways, disease does not exist until we have agreed that it does, by perceiving, naming, and responding to it." What Mukherjee is implying is that cancer does not really exist until we study it, until we look at it, until we consider it, until it becomes pervasive to our society. And even though people in the ancient age did have cancer, it just wasn't as big of a deal because people did not really perceive it. They didn't really understand what it was. And this ties back into a reading that we discussed within our Understanding Science class through Hansen and his theories on observation. So what he says is that an infant and a layman can see the same thing. They're not blind. They just can't see what the physicist sees because they don't have the experience. And that's the same thing again in this case. The people in the ancient age didn't really know what cancer was, and therefore they didn't perceive it and they didn't understand it as much as everyone else. So even though they made the observations, their interpretations were not up to par with our interpretations today. Now, in order to define cancer, we have to be able to study patients. So a patient can be, just as the book describes, can be described as a traveler who just visited the kingdom of the ill. This person has returned from the kingdom of the ill, and we have to ask them questions in order to understand their journeys, and therefore relieve the burden of their story. So one of the things that many people know is that cancer is often correlated with the image of the crab, which I show over here. This is an image from Uranus Mirror. It's a constellation card. You can see different stars here, and that basically forms the image of a crab. Now, I myself have always wondered why cancer is correlated to a crab. What the book describes is that what Hippocrates, for example, saw is that a tumor with its swollen blood vessels all the time seemed to look like a crab dug in the sand with its legs spread around in a circle. So these legs are sort of the blood vessels going all around, and the bulging mass of the cancer, of the tumor, is the body of the crab. So it's really interesting just to see how, once again, their observations were on a morphological level. Obviously, for example, Greeks with Hippocrates, they didn't have microscopes, and they simply were only able to look at a person's body and see a bulge there, and that's it. Also, their definitions of cancer were therefore myopic as well. They weren't able to see if a cancer was malignant or not. So basically, any bulge within the body that seemed abnormal became classified as cancer. However, besides for that crab example, there were also other definitions of cancer that contributed to our understanding of it nowadays. So, some of you might be familiar with the term oncocytes. Now, oncocytes are usually used to refer to cancer cells, but what does that really mean? So, onkos means burden, and that basically means that cancer was considered a burden. And that's what it was called at first, just a physical burden. You have this mass sitting on you, sucking at your energy, depriving you of your resources, and that's what it was. It was a burden. But definitions after that burden example went further. And people not only did they start to describe exactly what cancer is, a burden, but how does it actually arise? And that was the fluidity theory. So there was a scientist named Galen who proposed, based on some fluidity theories at the time, that cancer was black bile, too much black bile. So first of all, to describe the different fluids themselves within the body, red fluid would be blood. If you had too much of it, then that would be problems related to that. You would have yellow, that would be yellow bile. Yellow bile would result in jaundice. White fluid was in fact phlegm, so mucus and things like that. And lastly, there was black bile, and that was perhaps the most severe at all. But what's really interesting is that black bile was considered to be everywhere. These four fluids, as you can see over here, were pervasive throughout the entire body. Now, black bile was everywhere, and that led scientists to conclude that although cancer could be excised and you can take it out, if you cut it, then your black bile is just going to spill out and spread to other places on the body. And after it spread other places, it would just grow right back. And that was a really, 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 really important observation to be made. Even though, of course, that's not really entirely true. Cancer isn't black bile that spreads all over the place. It caused scientists to realize that they shouldn't just be doing surgery all the time. Surgery back then was incredibly dangerous. It was just done like in the back of a barber shop, just someone taking a knife and just cutting off a tumor. That was incredibly dangerous because it could result in many infections. So it was really it was great for the study of cancer for that observation to be made. It was also interesting because it's sort of remnant of our current theory of metastasis, where cancer can spread. So the black bile, or in nowadays case, just a couple of cancer cells, can spread to other places, and then they can grow back new tumors. This also led to a systematic understanding of cancer. So it's a systematic malignant state where you have internal overdoses of black bile. So now tumors are just local cases of a wider bodily dysfunction that has invaded the entire body. So you have black bile in different cases in the body, and what a tumor is just a local expression of that black bile. So it's all over the place, but a tumor is just a local example. So really, cancer affects the entire body, and a tumor is just one example of where that's become very severe. So now, one last thing that I want to consider before I finish these conversations about this part of the book is, how does this affect the study of cancer in general? Now, I mentioned paradigms here, and what's possible is this led to a different paradigm of what cancer is. So I'm not going to say that it's really a paradigm shift, but it does tie into the theory of paradigms, because scientists started to begin to focus, and they started to see what tumors really are. Tumors are not the cancer itself, but tumors are just an expression of the cancer. This related back into surgery, and then it led on to a systematic study of cancer, because you have black bile throughout the body, but you have more black bile in different places. And it throws off, coming back here to our four types of fluids. The problem was that those fluids were supposed to be in equilibrium, but in the case of cancer, your black bile was not really so good. It wasn't really so healthy, and it wasn't in equilibrium. And that led to the rise of systematic medications, because if you have a systemic disease, then you could treat it with a systemic medication. So that led to, they didn't have the same medication as today, but they started to use different herbs to treat cancer, and people started to think that if you have cancer that's in certain places of the body, let's take it and let's fight fire with fire. Cancer is formed in a certain way, let's counteract cancer and countervail it with a similar strategy. And that led down the road to cancer we have nowadays. There's a couple jumps that occur, and I'll be discussing more about the road to cancer today in further videos. Thank you.